So my name's Anwar Khan. I used to be chair of Waltham Forest. I'm now back to the front line where I belong. So this talk's going to be a game of two halves. So I'll do the first part, and then Sam's going to come with pictures and talk about his part of the talk. It's really about the GP's view of practice nursing in a changing primary care landscape. So how do you get the GP view? We look at the Royal College of GPs, actually. They've done a really good document about 5 years ago, actually, talk about the GP or primary care in 2022, and you've heard of the long-term plan so far. So what are the challenges in the NHS? There's constant change. As you know, you daren't blink nowadays because you might miss a change. And there is a lot of squeeze on the public expenditure. As mentioned earlier, Angie said, people living longer, so you're getting great-grandmas as well, but they're with multiple conditions. And we're going to have to move that complex care into primary care because secondary care is too expensive. Sam and I have spent, well, I've certainly spent the last 5 years with Sam trying to break down outpatients, haven't we, Sam? And bring more care into the community, which is actually where practice nursing really has its forte with long-term conditions, etc. And really thinking about how we actually integrate with primary and secondary care. And more importantly, where, again, nurses are much better than doctors on, is promoting healthy lifestyles. And we know about the growing inequalities as well. So we've talked to primary care networks, PCNs. Yeah, this is really about federated organisations. And the idea will be, and it's actually based on some of the trial models already in Tower Hamlets. You've been doing this for a decade or so, haven't you, Sam? We're only just starting in other parts of North East London, of looking at some of the sharing the back office functions. But more importantly, providing community nursing and practice nursing together. I think there's been this artificial barrier between, oh, this is a district nurse's job, this is a primary care nurse's job. And then other services, so physiotherapy, pharmacists. There'll be other new kids on the block, the physicians and associates that, again, Sam and I were very keen on doing through the Transforming Services Together programme in QMUL. So primary care is not, as I would suggest, it's actually a whole raft of specialisms. But again, trying to find out where we all fit in that matrix rather than competing and saying, oh, that's my job. I think there's room for all of you. And what we need to be doing is where is your forte? And actually build on that and then maybe connect with other professionals. As I say, the other jobs will be about coordinating care with out of hours, etc. But more importantly, I think quality improvement. And these are the activities you want to think about. So in my own practice, I think Catherine's here, isn't she? Yeah, I'm going to embarrass you. Catherine's been taking the lead on QI. Why should it be the usual culprits of GPs? And hopefully what we'll do is also encourage our reception staff to start taking much more of a greater lead in that. So as I've said, practice teams in 2020 beyond will be much bigger. And we need to think of how we actually coordinate together. I do think you need to think of what I call a careers escalator. Because in general practice, certainly, the organisations are quite small, but primary care networks will be bigger. So there'll be room for further roles. And you may want to think about nurse associates and how that escalator moves up to nurse educators. And again, I noticed Catherine's done the TTT course, the Teaching the Trainers course for general practice, but she doesn't have a GP trainee for herself. There's an inequity in education, and we need to think of how we can actually improve that. And certainly, I think the additional qualification, like independent prescribing, I've been recommending for my PAs who've been coming out from QMUL, because that is where you're going to get a lot more autonomy, or GPs are going to say, I still have to sign the prescription. So I think trying to get those additional qualifications is quite helpful. And I do think, actually, federated practice is the way forward. We know there are some, so in Waltham Forest, when I first became chair, one of the conditions, because I didn't aspire to be one, I was asked to be one, so I could put some conditions in. One of my conditions was actually some money for education. And we set up a nurse forum led by Ruth over there. And the sad bit is, some of my nurses in Waltham Forest can't come because their employers won't release them. And I think that's sad. And it shows lack of value, but also short-sightedness by some of the practices. And it's usually the smaller ones. But as we move to federations, I think there's an opportunity to think much more strategically. And again, people have talked about the interim people's plan. I've just taken some bits out of that that are really applicable to the nursing, really. But the first part's really important. It's transforming the way our entire workforce works together. And that's why we've got to think about how we work together, where our strengths are, and how we actually utilize others, like PAs, into the system rather than feel threatened by it. Workforce shortages, nursing particularly. Everyone talks about 5,000 GPs. Actually, there's a lot more nurses we need as well. I still don't, I've not understood where this 5,000 number comes from, by the way. Anyway, but we do need to think of this work for the 21st century. And Angie, it was really inspiring what she talks about, having a silenced voice. Because I don't think you do shout from the rooftops enough. And I do think nurses need to start working much more collaboratively, maybe like the Nurse Forum in Waltham Forest, and have a joint voice. But also think about using training hubs. So Ruth plays a very important part in our training hub when we actually teach on the PA preceptorship program. So I think there's something about nurses also being a bit more upfront and less modest, actually, because I really think that's really important. Last night, actually, I saw a patient with COPD, and I said, I'd like to go and see Marion, our nurse practitioner. Oh, she's only a nurse. I said, actually, well, absolutely. And she's only a practice nurse. She's not a proper nurse. I thought you'd like that. I thought you'd like that. This was only last night. And I said, actually, she knows more about respiratory medicine than I do. And they were quite shocked. And I do think you need to be shouting on the rooftop. Marion's been with us 3 years, Catherine? 5 years, there we are. And my patients still don't know how good she is. So it's really important to think about that. But again, just reinforcing what Angie said, think about writing your experiences, because the power of the pen is mightier than the sword. Really important when you start thinking about that. And certainly in my own practice, because I'm bereft of any leadership qualities, having stopped being chair of North East London, I've become exec partner in my own practice. And I made sure that at our senior management team meeting, we have a nurse voice there, because it's really important, and it's really helped planning for primary care services. So I'm just going to finish on Florence Nightingale's quote. I'll let you read it. Okay, we need more leadership from the front line. Anyway, Sam, over to you then.
So, first of all, what I'd like you to do is stand up and turn to the person next to you and tell them what you would like to be doing. What's your aspiration in the next 5 years? And I'll give you a minute to do that. So be warned, I'm going to get you to do the same in 15 minutes' time, and my challenge is to persuade you to come up with something new around aspiration. So I'm going to take you actually around Tower Hamlets, Bromley by Bow country, and talk a bit about what some of the amazing nurses are doing around the country, how general practice is changing, and how the nursing role is changing in that process. That's the Bromley by Bow Centre, but this is Mile End Road. And a key part of all our future job is population management. Now, notice the 5 chicken shops in a row. There are 42 chicken shops per secondary school in Tower Hamlets, okay? And I jest not when I tell you that I recommend McDonald's to my patients because that's the healthy end of the market. That's the challenge we face, along with 5-year-olds, 50% vitamin D deficiency, 40% and more with dental caries. I've got that, my generation did, my 5 kids don't, okay? And cognitive development, 10% below the national average. You see, there's a massive challenge for us. We in general practice will see 90% of the population in a year period. That's an opportunity that Tesco's or any other company would die for. It's an opportunity for us, while you're here, actually, what are we going to do that's much wider than the traditional things we do in general practice? 10 years loss of life if you're inactive, okay? Just think about all these wider things. What's the real cures of diabetes? Is it the drugs we prescribe? No, it's the consultations, it's the lifestyle, it's the exercise. So we need to be doing something very, very different. There's something about how we work too. So if you ever get an email from me, it will say, what am I about? What's the general practice about? Is it about fantastic outcomes, great general practice? No, it's very, very simple. It is fun, friendship, compassion, and assume it's possible. That's what it's about. And if you do that, you will create, I believe, an amazing team. Now, why that was particularly important to me was 12 years ago, I was in BMA House. I was the acting chair of the BMA at the time, and I had to lead the group of doctors trying to manage the people who'd been injured and died in the bus bomb. And I came home that night and I thought, actually, what is our role in all of this? Now, have a look at that picture. That's at Bromley by Bow, but how often would you see that? If you bomb somebody, you hate them, you don't know them. Actually, we also have a critical role in bringing together our society, dare I say it, at a time where it's very divided around Europe, but actually critical to us. Critical to us is that role of bringing communities together. What, therefore, do you need to think about as your new role? And the answer is yes, everything we learnt at nursing and medical school. But that's only a fifth of what we need to be focused on. We need to focus on the environment, the patient's environment. We need to focus on their education. Any education will make you healthier. We need to focus on their job. Any job will make you healthier. And we need to focus on their creative or spiritual side of life. That is what you need to do in your 10 or 15-minute consultation. No pressure. But what I'm about to show you is how a team can make that happen. How a team makes me a better doctor. So I've got 4 practices. The one where I do my clinical care is outstanding CQC. I am not an outstanding GP. I am outstanding because of you, because of my team. And that's the message going forward, actually. You're not an island on your own. You will deliver great care and great medicine if you work as a team. So the environment's really important. This is our health centre. Notice no NHS sign. Notice that when you come through, there's wisteria hanging up there. Notice that there's no signpost telling you where to go. If you arrive here, first of all, you walk past it, because you say, that's not the NHS. Then you come in, and there was a lovely health minister, John Reid, do you remember him? Gruff Glaswegian, who was into NHS branding in those days. So he was horrified we didn't brand it. He was horrified there was no signpost. And I looked him straight in the face and I said, Minister, you must understand we encourage our guests to get lost. Well, he took a bit of a double take, and then I explained what happened when you arrive here. And the answer is somebody says, you look lost, can I help you? Or you say, I'm lost, can you help me? So the corollary of this, of course, and of course you have great conversations, the corollary of this for a hospital is take all the signposts away, make sure all the patients get lost, because the great conversations and caring that comes from that will be absolutely fantastic. The message I'm giving you is think out of the box, and I will come back to your role as leaders, but break the rules. So one of the things I'd like you to think about at the end, which rule are you going to break in the next week, okay? Of course, in the patient's interests, but if you are a true leader, you break rules. And of course, this, I said also, assume it's possible. That's about saying yes as leaders. Now, the NHS is great, isn't it? We've got to do an evaluation. We need a business plan, or it's got to go to some committee. Now, these are all brilliant ways of saying no. We say yes. So this started life as a leg ulcer and flower arranging clinic. It isn't one anymore. The nurse came to us and said, it's mainly women, leg ulcers, immobile, overweight, lost their self-esteem, smelly wounds. We need to do something different. Flower arranging, got them out of their homes, into the centre, brought back the joy of their life, brought back mobility, created great wound care. moved on actually to create an amazing organisation, social enterprise run by an amazing nurse in Tower Hamlets called Accelerate, that saves me as the CCG chair 600,000 a year. You can ask me the question later how she does that, but delivers on wounds. They've now changed their name. They call themselves Young at Art. And of course, this is a really key message. So this is in my consultation room, but notice how I'm sitting next to the patient. Actually, I have never worn a tie. I have never used my titles to patients. The only time I ever use my titles is to give somebody a good reference. That partnership approach with patient is absolutely crucial. Of course, my mother claimed it was I was a scruff. She's right. You probably see some of that here. But actually the detail of that is really, really important. Flowers on the desk, pictures of your family on the wall. That sense of partnership with patient, which will give you the best outcome. Don't get me wrong, if I've got doctors as patients, you need to be very direct. They've read everything, you just need to say, sit down, I'm going to sort you out. But for the vast majority, this is about working with, in partnership. And of course, then when you think about what other things you need to do, so why wouldn't you have an egg and spoon race at your surgery? And I'm not going to tell you who's a patient and who's a very senior director of Barclays Bank. Because why wouldn't you do that with Barclays Bank? Paralympics, okay. Jobs advisor, but also selling stuff for the garden, flowers at the same time. Allotment gardens. So I did a presentation 4 years ago, and then last week with Fatima, you'll see a picture of her in a sec, to the National Gardening Scheme, who are an amazing organisation that actually give money to the Queen's Nursing Institute every year. These are amazing people. We persuaded them to do a report on gardening and health. I recommend you look at it. It's King's Fund. There is nothing better almost than you can do for your health, both your mental and physical health, than gardening. It's not that half an hour of half exercise. It's activity, increasing your mental and physical activity throughout the day. And of course, in our projects, we'll have a love story. These are two of the patients. They don't mind me saying so. This is a couple of patients with learning disabilities, now part of the gardening project, and now an item. How wonderful is that? Anything I can do to produce a love story, that's part of my job as a doctor. It's part of your job as a nurse. And of course, this is Fatima, our advocate, who's set up a project called Grannies in the Kitchen, and now a walking group. This is our social prescribing. So this is all under the auspices of social prescribing, which we started 30 years ago, which I put in every practice in Tower Hamlets 5 years ago in Tower Hamlets, and which we then persuaded the ministers to put in every practice in the country. By the way, why do we call it social prescribing? I'm going to let you in on a little secret, because it's a very odd word, and everyone always challenges this question. So don't tell anyone this, okay? But it's a secret conspiracy to re-educate all the doctors in this country without them realising it. And that's why we call it that. We use their language. And of course, this is the front of our cafe. You can walk in there off the street. This is where our social prescribers hang out. You can have a consultation. It can be, my plumbing's a problem. It can be, my housing a problem. Or it can be, I'm just lonely. Whatever it is, you can come in here and you'll get help. And of course, on the desktop of every GP is a referral form. Takes 20 seconds to fill in, and of all the nurses. So you don't need to think about it, actually. You just have to have that light bulb moment that maybe, just maybe, this patient needs not a prescription, not a referral to the hospital, but actually something much wider. And this is powerful stuff in its impact, and you'll see why in a second. And of course, we're a community university, so we run lots of courses. Now, this is one of our nurse partners. This is, by the way, not the uniform of the practice. Just in case you're wondering, this is the Norwegian national costume. She has been a full profit-sharing partner of the practice for over 20 years. She earns the same as I do, okay? So there's an aspiration, okay? She's also director of the Primary Care Network and the director of nursing for the practice. She's also my wife. I thought I'd better declare a conflict of interest. And of course, this is our nursing team. And so I wanted to introduce you to them to tell you the sort of amazing things they're doing. So obviously, you've met Linda. So you've got Nicola here, okay, who's basically the lead of the healthcare assistants. Absolutely amazing, the stuff she's doing. Christine there, the next one, okay, she's the phlebotomist, so she's part of the nursing team. She has no formal education at all. She is the most amazing clinician I've ever come across. Not long ago, she rang through to me and she said, Sam, I want you to see this patient. I think they've got pyelonephritis. Now, she sees everyone who needs bloods. So she knows all the people with long-term conditions. So what is she doing? How does that happen? The answer is she notices if there's a difference. This is the strength of what you and we do as doctors. It's noticing the change. And she said, and so she asked the patient, you look a bit off colour. I said, yeah, I've been going to the toilet a bit more frequently. So what did she do? She tested the urine. She saw the nitrites. And she then said to the person, yeah, have you got any pain anywhere? She said, yeah, I've got pain on my back. So she rings through to me. And by the way, this is a patient that's been to casualty twice, and they missed the diagnosis. This is my point about teamwork. And that is quite incredible. And that's the aspiration you should have for everyone in your team. And then there's Kirsty here, who leads all the chronic disease management. So Anwar talked about chronic disease. I can tell you truthfully that Kirsty and her team know far more about diabetic management, COP management than I do. Isn't that incredible? And then you've got Siobhan, the final one I'm going to tell you about, okay? But I'm going to start, first of all, by asking you a question. You have a choice. You've got a terminal illness. Your choice is to die at home, surrounded by your loved ones, or die in hospital. Please put your hand up if you want to die in hospital. No. Actually, the only time I've ever had anyone put their hand up was a chief exec of a hospital. I wasn't quite sure whether that was loyalty to her hospital or if she didn't have any loved ones at home, but there lies a key message. By the way, 47% of people with terminal illness die in hospital. That is absolutely shocking. So Anwar talked earlier on about how we're trying to shift this care out into the community. Okay. Now, Siobhan runs the MD team, multidisciplinary team meeting every month, where we manage the 5% of patients with complex care, terminal illness, houseboundness. Where I work, it's 14,000 patients, and I'm on call usually on a Monday and Friday morning. Nightmare territory. It's unusual for me to have a visit. Why? Because her team manage everything proactively, and then we work out who's going to manage what. And very often I will get heavily involved in the last days of life because of issues around death certification. But let me tell you what that means on a personal level. 82-year-old patient of mine rang me at 6:30 in the morning. I live right next to my surgery, and said, my husband's just died. He was a patient of mine too. I said, I'll be round about 1/4 hour. I picked up the death certificate book from the surgery, popped round to her, gave her a hug, had a cup of tea. We wrote the death certificate together, so explained exactly what I was going to write, what the causes of death were. I took the catheter out. I took everything else out, so we laid the patient out. And then she said, I just don't want my husband to go. And I looked at her and I said, well, there's only one thing you have to do legally, and that is take this piece of paper to the town hall within the next 5 days and register his death. Ring the undertaker when you're ready. That is a consequence of what Siobhan does, and that, I suspect, is something that you would want of your nearest and dearest, and is entirely possible, and is entirely only possible with an amazing nursing team. So this is Caroline, aged 50, throat cancer, surgery, lost her voice, lost her job, came on one of our art courses, didn't like it, and then came on one of our IT courses, did like it, retrained in IT, back in employment. That's part of our cancer social prescribing, a project that we did with the Macmillan service. And this is an amazing two nurses. So we're going a bit around the country now. There's amazing nurses who reduced death in hospital from 47 to 14%. How? Skype consultations, 24 hours a day. How amazing is that? So something about thinking out of the box. And by the way, I give my patients my mobile number and email address. Is it a problem? No. Occasionally I've had to do consultations out at sea. I'm also a skipper. But actually it's not a problem. Do you know what? Less work. Actually, they get hold of you when they need you, not when it's convenient for you. They are in control of their life, but most importantly, they're in control of their death. And the greatest gift often you give is to the nearest and dearest who are terrified about managing death at home. But if you hold their hand through it, what it does in terms of bereavement. And the times I've sat, as I did with that widow, and said, by the way, I'm going to speak for your husband now, and I'm going to say just a very big thank you for what you gave me. And that was the greatest gift in life, which was a good death. To die at home with you, the person I love most of all. And of course, this is a DIY project. We won a national award for it, run by some of our nurses. Reduce reattendance in casualty and in general practice by 35% by inviting in parents who had young children and were worried about managing minor ailments. Just teaching. And isn't this the future? You will hear later on about joint consultations. And I've just been persuading Linda also that we should do consultations down at the swimming pool. Mm-hmm. I'm game. I'm ready to get in my swimming trunks. I swim every day anyway. And actually hold consultations in the swimming pool. Think out of the box. Amazing. Reduced, so this is a nursing team that reduced acute psychiatric admissions by a third. So we're talking about acute psychiatric admissions. How? Opened up a cafe 7 days a week with mental health workers. And finally, this comes back to Bromley by Boat. So I want to lead you with two thoughts. Remember fun. Actually, I saw that here this morning. I saw fun, friendship, compassion, and assume it's possible. That's about saying yes. And then finally, I want you to think about you as leaders, because actually anything going forward, whatever your aspirations are, will depend on you all being leaders. So what is a leader? A leader is somebody who wants to better their environment. A leader is somebody who's positive. This is not cup half empty. This is not cup half full. This is cup overflowing. Positivity. A leader is somebody who knows themselves and their teams. This is really, really important, okay? You're to be a good leader. So I have a chief exec of my organisation who's completely different to me, but we know each other really well, and she certainly knows how to tell me off, thank God for that. She lifts her eyebrow, or she uses the word indeed, and then I know I'm in trouble. So if you want to be a leader, surround yourself with somebody that can tell you what an idiot you are. Okay? Really, really important. And finally, your role as leader is to create other leaders. So I'm a parent of 5 children. What is the greatest joy in my life? Yes, it's that 2-year-old who produces that painting, which of course should end up in the Tate Gallery. It's the joy actually of seeing other people succeed. So actually create other leaders. And finally, go back to my original message. Break the rules. So I want you to finally stand up and talk to your neighbour again about, is there another aspiration you've got? Thank you.